Hit this. Sure. Yeah. So it's like that thing.
Welcome to Jeopardy. Okay, great. So we are going to go ahead and get started. We'll start by introducing today's teams. First, we have the Wookiees. And if you guys can turn on your speakers and please introduce yourselves and where you're from.
I'm Caitlin McIntyre, a fellow at MSK.
I'm Matthew Strand, a fellow at Carolinas Medical Center, Charlotte.
I'm Lucas. I'm a fellow at University of Cincinnati.
Next team, the Jawas.
I'm Darren Cullinan, fellow at WashU in St. Louis.
I'm Winnie Lowe. I'm a fellow at Pittsburgh, but I was previously at Cincinnati.
I'm Jonathan DeLong, and I'm a fellow at Stanford.
And our final team, the Droids.
I'm Ashley Russo, and I'm a fellow at Cedars-Sinai.
Hey, I'm Rahil Jaja. I'm a fellow at University of Alabama, Birmingham.
Guido Fiorentini, HPB Fellow, Mayo.
Thank you guys for participating today. We're very happy to have you. And today's categories are the power of the dark side, the pathogenesis of hepatobiliary disease. One-armed wampa, pancreaticobiliary anatomy. Do or do not, there is no try. Minimally invasive HPB surgery. Death Star secret plans, diagnostic tests and imaging. and never tell me the odds, morbidity and mortality. Luke and Leia, famous HPB surgeons. So with that, here's the board. Please remember to answer in the form of a question, otherwise you will not get credit. Which team is presenting first or picking first? Dr. Schmidt? The droids. All right. Where would you guys like to start?
1,000 of them. One-armed Wampa for 1,000.
One-armed Wampa for 1,000. The right posterior sectoral bile duct may cross or hook over the origin of the right anterior portal vein pedicle, and the relationship carries this anatomic name. Bueller, anyone?
You want to call that Rouvier? Sulcus is not the Rouvier. This is the only thing that I know.
No.
What?
So is crook, yeah.
How do you pronounce that?
What is Yotsoy's crook? It's in the parentheses how you pronounce it. All right, go again.
One-armed Wampa for 800.
Okay, one-armed Wampa for 800. An accessory right hepatic vein typically drains this liver segment. Go ahead.
Usually segment 7.
What is segment 7?
No, sorry. What do you have to answer?
You have to make it a question. This is the answer.
You,
Is segment 7.
Oh, sorry.
What
Probably
segment-
the-
what is the segment 7 draining branch?
what is the segment 7 brand? I don't know.
We have to
Are you guys
pick.
sure? Incorrect. Other team? No.
What is the segment 6 vein?
That is correct. What is segment 6?
Oh, debating.
So Jawas.
Okay.
You guys get to pick next.
So do we have to do?
One arm Wampa for.
Can we get the board back?
600. Yeah, 600.
Okay, one-armed Wampas for 600. This anatomic variation, which occurs in about 20% of people, can increase the risk of right hepatic artery injury during laparoscopic cholecystectomy. Yep, okay. The Jawas have it.
What is replaced right hepatic artery?
What is replaced right? What is anterior to the common hepatic duct? Yeah, you answered it. So nobody gets credit, but you guys lose some points. But now nobody else gets to answer.
We lose when it runs. Right, it runs anterior hepatic duct, I guess.
We're having AV complications, okay?
Should have read that one.
All right. You guys get to pick again.
No, I would guess. it's the same. Yeah.
I don't think that was.
And,
Okay.
Like,
Jawas, you want to pick again?
sure, one-armed Wampa for 400.
Okay, one-armed Wampas for 400. The falciform ligament is the convergence of these two ligamentous structures, some of whom might take this to the heart. Heart. Wookiees?
What is the round ligament and the Erantis ligament?
Incorrect. Anyone else? Any other takers?
What is the round ligament in umbilical vein?
Incorrect. You guys see the word heart?
What is the coronary ligament and the triangular ligament?
The answer is, what are the right and left coronary ligaments? They said the coronary ligament, but they also added a triangular ligament, so I don't know if you want to give it to them.
How about just break even?
50%.
All right, Jawas, pick again.
One arm waffle for 200.
All right, here we go. Sorry, I'm bad at this. Cantil's line connects these two structures and outlines the trajectory of this vascular structure. Wookiees, go ahead.
What line in the liver is connecting the gallbladder to the cava? Acceptable. So we are the first one scoring. Okay, $200.
All right, go ahead, pick again. No, it's reset.
Sure, 1,000. Go for it.
Death Star 1000.
Death Star 1000. This is the NCCN guideline resectability status for a pancreas cancer in the head uncinate process with solid tumor contact along the SMV of 100 degrees. Go ahead. Wookiees.
Go for it, man. It's your What is resectable pancreatic cancer?
Correct. Wookiees. Oh, sorry, droids. Not the Wookiees. So the droids should currently have 1,200. I mean, in positive, and I don't know how many they've lost already.
So we have 1000.
No, yeah.
We should have 1000.
No, we've.
It's okay.
You have 1,200.
Okay.
You want to go backwards?
No.
I just gave you like an extra 200 points.
That star for 800.
Death Star for 300, is that you said? 800. Could we have Death Star for 800, please? This is the NCCN guideline resectability status for a pancreas cancer. It's that, no, it's a different one. It's different. Pancreas cancer in the head uncinate process with solid tumor contact along the SMA of 100 degrees. Droids.
What is borderline resectable pancreatic cancer?
That is correct. Why'd you guys push it again? That was correct. Pick again, please.
That star for 600.
Death Star for 600. This MRI contrast agent allows for intracellular hepatocyte phase imaging approximately 20 minutes after injection. You have to wait to push your button until I'm done reading the question. So if I read slowly, you just have to wait. Wookiees, go ahead.
What is gadolinium?
Did you say what is, what did you guys say?
They said, what is gadolinium?
Okay, no, try again.
Okay, so can we answer?
Yes,
Yeah, go for it.
What is EOS?
that is correct.
The same thing.
No, they're different.
That star for 400.
Death Star for 400, please. Sodium excluded. These are 3 lab values used to calculate the MELD score. Droids, go ahead.
Really, I should get this right. Okay. What is INR, total bilirubin, and creatinine?
That is correct. Pick again, please.
That star for 200.
Death Star for 200. If the intern forgets to specify a triple phase CT scan, you have to wait till I'm done reading. Disqualified. If the intern forgets to specify a triple phase CT scan, only this phase will typically be available on the routine contrast enhanced CT. Jawas or Wookiees, you may answer. Okay, Jawas, let's hear it.
What is a portal venous phase?
That is correct. Jawas, please pick again.
There's no try for 200.
There is no try for 200. Not restricted to MIS procedures, this uses a tape passed posterior to the liver along the anterior IVC and facilitates liver resection using the anterior approach. Droids, go ahead.
What is the hanging maneuver?
That is correct. Please pick.
What do you guys want to do? Okay, okay. There is no try for 1,000.
There is no try for 1,000. This Dutch study, a randomized control trial comparing minimally invasive to open pancreaticoduodenectomy, stopped early due to higher mortality rates in the laparoscopic cohort. Everyone other than the Jawas pick again. Okay, droids.
Is that up to us?
Yes,
So
because they've hit it
what-
too early.
What was the leopard study? Leopard.
Also known as a leopard. Yes.
Leopard.
What is the leopard 2 study? Okay,
It's okay, Italians pronounce it differently.
leopard sounds better. I prefer it, but most of the people in the audience don't know what a leopard is. Okay, pick again, please.
A leopard.
We'll go with, yeah, there's no try 800.
Okay, there is no try for 800. The first reported laparoscopic Whipple operation by Gagner and Pomp in 1994 was done for this indication. The Wookiees.
Chronic pancreatitis.
That is correct.
That was not a question.
What is chronic pancreatitis?
Okay, go ahead, pick again.
That for 600. Okay.
All right. There is no try for 600, please. This French surgeon published a pioneering prospective cohort study of 30 patients after laparoscopic liver resection in the year 2000, the largest series at that time. Droids.
Who is Belgidi?
You had the
Okay.
first letter right.
Uh,
Delgidi?
mhm.
No, incorrect.
Briscae? Who's Briscae?
Anybody else? Who is Daniel Cherky? Droids, go ahead, pick again. Okay. There is no try for 400, please. Surgeons met in this U.S. city in 2008 to discuss and write a formal international position on the status of laparoscopic liver surgery. Wookiees.
What is Louisville?
That is correct. Wookiees, pick again. Oh, no, not again. I guess just Wookiees.
Let's
Go
do
ahead and pick.
Luke and Leia for 1,000.
Luke and Leia for 1,000, please. Dr. Thomas Starzl and team performed the first combined liver and heart transplant in 1984, the year in which the scary movie was tops at the box office.
What is Jaws?
No, that is not correct. Go ahead, Wookiees.
What is Ghostbusters?
Did you say what is? Yeah, okay, good. That is correct. What is Ghostbusters? Go ahead, please pick.
Do the same for 800, please.
We have Luke and Leia for 800. The first living donor liver transplant occurred at this hospital. Wookiees.
Universal São Paulo, Brazil.
Say University of Sao Paulo?
Yeah.
That is incorrect, and you didn't answer in the form of the question anyways.
It was. What is the University of Colorado?
What is the University of Colorado? No. Droids? You're going to pass.
We'll pass.
Okay. The answer is, what is the University of Chicago? Who was picking? Was it the Wookiees?
Yeah.
Go ahead, please pick again.
We'll take Luke and Leia for 600, please.
Okay, Luke and Leia for 600. This surgeon was the first to resect the head of the pancreas in 1898. Wookiees, go ahead.
Who is Dr. Couch?
Who is who?
Doc-
Sorry, I can't hear because I don't get the mic.
Who is Dr. Couch?
Who is Dr. Couch? That is incorrect. Droids,
Who was Dr. Bill Roth?
incorrect.
Give it a try.
Pass.
Pass, okay. It was Alessandro Codiviglia. Okay, Wookiees, you gonna pick again?
We'll do the same category for 400, please.
Luke and Leia for 400. This surgeon was the first to perform an anatomic distal pancreatectomy for a solid tumor in 1882. You also sometimes position your table a certain way. Droids,
Who is Trendelenburg?
that is correct. The audience is mad at me for giving you a clue. I mean, did you guys want to be up here? Yeah, I didn't think so. Okay, good. I know you are. They're mad. Go ahead, pick.
200, please. Luke and Leia.
All right, Luke and Leia for 200. Sharing initials with a common opportunistic infection, this past president of the HPBA has encouraged capitalizing on opportunities with an infectious energy. Wookiees,
Who is Mike D'Angelica?
who's who?
Dr. D'Angelica?
What opportunistic, what's the infection?
Oh, wait, this pass.
I don't,
Capitalize on opportunity.
what's DA? MDA? No, incorrect.
Who's capitalizing?
Anyone else? Who is Charles M. Vollmer? CMV. All right. Wookiees, were you guys picking? Yeah. The Wookiees are doing
Zero.
okay.
Second
The
place.
droids have 1800 and the Jawas.
When did this happen?
What are the categories left? I can't see.
Uh,
Or it's the HPV.
And the M1.
Wookiees?
We'll do the HPV pathologies one for 1,000. Sorry, I can't read it from there. It's the power of the dark side for 1,000.
Our screen is very small. A congenital anatomic variation that can predispose to formation of a choledochal cyst and or gallbladder cancer. Droids.
What is APBTU or aberrant pancreatobiliary ductal union?
Good enough. What is an
Junction.
anomalous pancreaticobiliary junction? Go ahead, please pick.
Power of the dark side for 800.
All right, power of the dark side for 800. Mutations of this gene increase the risk of chronic pancreatitis. Droids.
What is a PRSS1 and CFTR genes?
That is correct. They get extra credit for naming too. I'm nicer, huh?
You are.
Yeah,
Much
okay.
nicer.
I know. They don't think so.
Yeah. Power of the dark side for 600.
Okay, power of the dark side for 600. The most common gene mutation observed in pancreas adenocarcinoma. Droids.
What is the KRAS mutation?
That is correct. Go ahead, pick again. You guys are getting annihilated.
Power of dark side for 400.
Power of the dark side for 400. The most common risk factor for hepatocellular carcinoma worldwide. Okay, the Jawas.
What is hepatitis C virus?
That was incorrect.
What is hepatitis B virus?
That is correct. Would you like to do the last block in the category?
Sure, yes.
All right. The embryologic descent of a left adnexal structure explains the gender and left-sided predilection of MCN and the presence of this finding on histologic evaluation. Wookiees.
What is ovarian stroma?
That is correct. All right. Last category. Never tell me the odds. What do you guys want to start with? Okay, never tell me the odds for 1,000. That's your daily double. Okay. You just got some points. Finally. You can, whatever you wager, you get to pick your wager, but you have to have money in order to wager it. So,
Yeah.
Wookiees, how much would you like to wager?
200.
All 200, going big. Okay. Can we have the question, please? 200. No, it's a daily double, not a final Jeopardy question. Okay, we're going to allow you to go up to 1,000. Would you like to go up?
Yes, we'll do
Yeah.
all 1,000.
You'll do all 1,000. All right, so they're wagering 1,000. This complication of acute pancreatitis and pancreatic fistula results when central pancreatic necrosis and pseudocysts develop between the proximal pancreas and viable distal pancreas. There's only one team answering.
What is a disconnected duct?
That is correct. You guys are up to
Well-
1,200. Look at that. Okay, go ahead. Please pick.
We'll take that for 800, please.
All right. Primary graft non-function occurs approximately this % of the time after deceased brainstem death donor liver transplant.
What is
That is correct. Why are we pushing a button again? Go ahead, please pick. All right. This opportunistic infection is more common after pancreas transplantation than either kidney or liver transplant.
what is CMV infection?
That is correct.
I believe it's DeAngelica syndrome.
No, Dr. Volmer syndrome.
Go ahead, pick again. 400. This physical exam finding justifies emergent angiography in a hospitalized patient after pancreaticoduodenectomy. You guys are the droids, right?
Okay,
Yeah,
yeah. What is bloody drain output?
What is what kind of output?
Bloody drain output?
Bloody drain output, which is typically red.
Yep.
That is correct. $200, please. A postoperative pancreatic fistula requiring percutaneous drainage of a peri-pancreatic fluid collection is classified as this grade according to ISGPS guidelines. Wookiees.
What is grade B?
That is correct. All right. We already answered that. That's it for first round of Jeopardy. Can we see the scores?
It's okay. You don't have to.
No. No, it's okay. Jawas, you want to get up and shake it off or something? Or you okay? All right. We're going to have Dr. Schmidt come up here and moderate the second half. Yeah, there's a second. There's another Jeopardy.
Thank you. Yeah, if you were thinking of something that's gonna be fine.
All right, nice job, players. Going to keep on rolling with Double Jeopardy. The categories are Bacta Tank or HPB Pharmacology. This is the way for you Mandalorian fans. Jaundice and biliary obstruction. Fear is the path to the dark side. HPB and infectious disease. Let the Wookiee win. Surveillance and survivorship. And Ewoks rule. Medonk, Radonk, IR, and GI. Frozen in carbonite or transplantation. And we can show the scores again real quick. I think, yeah, and if you advance the slides, I think you'll get to the Double Jeopardy board. All right, so which category would you like to start with? So we have Wookiees, Jawas, droids. Droids are starting. All right, go ahead and select.
This is the way.
This
For
is the way
1200.
for 1200. Endemic to Southeast Asia, the body or eggs of this leaf-shaped fluke can lead to biliary obstruction.
Clonorchus? What is Clonorchus?
That is correct. Was that the Jawas?
Yes.
All right, so Jawas 1200.
And we now have positive points,
Yes.
just like everyone.
Go ahead and select your category. No, I'm not resetting yet.
This is the way for 1600.
This is a new way. This is the way for 1600. The medication, dosage, and route of administration given to relax the sphincter of Odie when performing an intraoperative cholangiogram. Is that the droids?
What is 2 milligrams of IV glucagon?
That is correct. So that was, you got the score? All right. Go ahead and select again.
This is the way for 800.
This is the way for 800. A rare complication in which a gallstone becomes chronically impacted in the cystic duct or gallbladder neck, causing compression of the common bile duct and jaundice. Droids?
What is the Meritzi syndrome?
Correct. Moritzi syndrome.
The pronunciation was good in this case.
Perfect.
Meritzi.
That's perfect. Select again. We could just finish out that category, or seems like a lot of effort to pick the category.
This is the way for 400.
This is the way for 400. A beaded appearance of the bile ducts that can lead to a dominant stricture. Is this disease? Droids?
What is primary sclerosing cholangitis? PSC?
That is correct. You guys' buzzers work? All right.
So frozen and carbonite for 1200.
Frozen in carbonite for frozen in carbonite for how much? For 1200. After total pancreatectomy and islet cell transplantation, this percent of patients are insulin-free at 1 year. We'll give you a 5% range either way. Droids? That is incorrect. Either other team? Try again.
What is 60%?
Also incorrect.
We have like 4 points.
What is 75%?
Also incorrect. What is 35%? Low, isn't it? All right.
So we'll go with frozen with carbonite and 800.
Frozen and carbonite for 800. The UNOS allocation policy attempts to equally distribute livers within each, UNOS allocation policy attempts to equally distribute livers within each region. Droids?
What is share 35?
That is correct. Next category?
Okay, fine. Frozen and carbonite for 1600.
Wow, really?
Frozen carbonate for 1600. One of the two biggest problems with bladder drainage after pancreas transplantation. Droids?
What is chemical cystitis?
Correct. Would have also accepted metabolic acidosis. All right. Select your question.
Frozen and carbonite 2000.
Give us 3 of the 5 criteria needed to qualify for transplantation for hilar cholangiocarcinoma. Who's got it? Down there, Wookiees?
Yeah. What is unresectable hilar cholangiocarcinoma? Cholangiocarcinoma in the setting of PSC and less than 3 centimeters.
That is incorrect. Droids?
What is a hilar cholangiocarcinoma that is unresectable, less than 3 centimeters, with either a elevated CA 19.9 or endoscopic biopsy proving the diagnosis, and no percutaneous biopsies have been attempted, and no evidence of metastatic disease.
That is correct. So classically, less than 3 centimeters, no negative above the cystic duct, no extrahepatic disease, no perc biopsy. Go ahead and select again.
Frozen carbonite 400.
The accepted rate of hepatic artery thrombosis after liver transplantation. Wookiees?
What is 5%?
That's incorrect. Droids?
What is 0%?
How much?
0.
Also incorrect.
I don't know.
What is 2%?
Correct. Right in the middle. Nice. All right, so minus 200 for everyone except plus 200 for the Jawas. So Jawas, you select the category.
Go for it.
This is the way 2000.
So back to this is the way for 2000. The pathologic histologic diagnosis of a benign biliary stricture that is analogous to IgG4 mediated autoimmune pancreatitis. Wookiees?
I think it's in like an IgG4 mediated autoimmune cholangitis. What is not autoimmune cholangitis?
That is incorrect.
Get the fancy name.
I think we'll call time on that one. What is LPSC, or lymphocytic plasmacytic sclerosing cholangitis?
Sorry.
So,
Now we're feeling the red.
yeah,
cannot
so Jawas pick the category again.
can't read those categories. So small. HPV and ID.
Which one?
Or-
Which category?
Fears the
Fears
path
the path.
for 400.
Fears the path for 400. Vaccination against these encapsulated bacteria should be considered at least 2 weeks before elective distal pancreatectomy and splenectomy. Looks like droids.
What is Haemophilus influenza, meningococcal, and strep pneumonia?
That's correct. I think that was actually, all right, so that was fears, the path for 400. What's your next one, droids? I think they're saying fear is the path for 800.
Yes.
This is the term for secondary infection of the gallbladder by gas-forming bacteria and is common in elderly diabetic men. Wookiees?
What is emphysematous cholecystitis?
That is correct. Wookiees you select?
Or 1,000, please.
Fear is the path for 1200, you're saying?
1,200, yeah. Sorry, it's far.
All right. This amoeba accounts for 10% of liver abscesses and is endemic in tropical areas. Looks like the Jawas.
What is Entamoeba histolytica?
That is correct. Now we're rolling. All right, Jawas. What's your next one?
1600.
All right, sphere is the path for 1600. This worldwide tapeworm infection causes hydatid liver cysts. Is that Wookiees?
Yes. What is echinococcus?
That is correct. Wookiees you select?
Take that for 2,000, please.
So fear is the path for 2000. The first AHPBA sponsored prospective trial in conjunction with HPB NISQIP compared these two antibiotics with respect to SSI rates. Looks like the droids.
What are Zosyn and Ansef?
That is incorrect.
Cefoxitin, damn it.
Looks like the Wookiees.
What is cefoxitin and Zosyn?
That is correct.
If I didn't get that, D'Angelo would be upset.
Could you give your questions sounding like a Wookiee? And similarly sounding like a droid? No? All right. So Wookiees you choose.
Categories.
We can't read the categories, but
So there's Bacta Tank, Let the Wookiee Win, or Ewoks Rule.
Let the Wookiee win for 200.
All right, Let the Wookiee Win for 400. The recommended surveillance strategy for
you reset the
HCC in
button?
patients with underlying cirrhosis. Looks like the droids.
An ultrasound, or what is ultrasound? Ultrasonography,
Can you give us an interval?
every 6 months.
That is correct.
Mhm.
How about next one?
Ewoks rule for 400.
Ewoks Rule for 400. This new dumbbell-shaped stent has greatly improved the endoscopic approach to pseudocyst decompression.
What is axiostent?
Jawa's axial stent, that is correct. Jawa's picked the next category.
Let the Wookiee win for 2000.
Let the Wookiee win for 2000. According to the revised Fukuoka guidelines for pancreas cyst surveillance, these three features were added to the worrisome category. Name at least two. Wookiees?
What is cyst growth greater than 0.5 centimeters over 2 years and lymphadenopathy?
That is correct. Nice job, $2,000 back in the game. All right. What's the next one? You have Bacta Tank, Let the Wookiee Win, or Ewoks Rule.
1,600?
Yeah, Let the Wookiee Win for 1600. The international recognized standard for adjuvant therapy after resection of biliary tract malignancy to improve survival. Looks like the Jawas.
What is capecitabine for the Bell-Cap trial?
That is correct. All right, Jawas, next.
Let the Wookiee win for 1200.
According to a randomized controlled trial from France, this adjuvant therapy regimen after resection of pancreas cancer optimizes patient survival.
What is FOLFIRINOX?
That is correct. Another correct one for the Jawas. Go ahead and pick again.
We'll finish off that category.
So let the Wookiee win for 800. This country has implemented a policy of cholecystectomy for all women under 40 years of age diagnosed with gallstones, regardless of symptoms. Droids?
What is Chile?
Yes, that is correct. So Ewoks rule or Bacta tank?
Let's go with Evox rule for 800.
Ewoks rule for 800. The systemic chemotherapeutic agent most associated with sinusoidal dilation and the so-called blue liver syndrome. Jawas?
What is irinotecan?
That is incorrect. Droids?
What is oxaliplatin?
That is correct.
Evox rule for 1200.
Ewoks rule for 1200. The guidelines to assess tumor response following liver-directed therapy. Painters also use it. Droids?
What is the recessed criteria?
The what criteria?
The recessed RECISD?
That is incorrect. Doesn't look at size, looks more at,
What is LIRADS?
also incorrect, but you also can't answer twice.
Sorry.
Perhaps we should just teach them that these are the EASL criteria. Go ahead and select again, I suppose, droids.
Let's go save. Something low.
Yeah, back to tank 400.
Back to tank 400. Dysfunction of these predisposes to a supertherapeutic INR in a patient taking warfarin with new onset obstructive jaundice. Droids?
What is protein CNS?
That is incorrect. I think that's time. Oh, in it, just at the buzzer, the Jawas, you can try.
What is cytochrome P450?
That is correct. Okay, Jawas, you go ahead and select.
We will do Ewoks rule for 1600.
Ewoks rule for 1600. 2 targeted oral systemic agents with proven efficacy in randomized controlled trials for advanced metastatic pancreatic neuroendocrine tumors. I think it's time on that one. Oh, again, right at the buzzer, the droids.
What is capecitabine and temozolomide?
I think that is incorrect. Everolimus and sunitinib.
I guess back to us then, so we'll finish
Yep.
that category.
Ewoks rule for 2000. Another daily double. May we see the scores? So Jawas, you have 3,600. Just so you're aware, the droids have 11,800 and the Wookiees have 2,200. So you might want to make it a true daily double.
Would someone mind texting Flavio that also? Dr. Rocha. Should we do 3600? Oh, we're gonna go for a broke 3600.
All right, they're wagering 3,600 on the question. The type of decay and half-life of the isotope yttrium-90.
It's a beta emitter, and the half-life is
sorry, what is a beta emitter? And the half-life is 72 hours.
I think that's pretty close. Yeah, I think we're gonna give it to you. Yeah. That's nice. This is nice job. All right, Jawas. Let's finish it up.
There's more.
Come on.
Whatever the first category is for 800.
Back to tank for 800. This chemotherapy agent is used for chemoembolization treatment of HCC. The Wookiees.
What is doxorubicin?
That is correct. Bacta tank for 1200? Yeah. This is an effective antidote for acetaminophen-induced hepatotoxicity. Looks like the droids.
What is acetylcysteine?
And
Acetylcysteine.
That is correct. Droids,
1600.
Bacta tank for 1600. This fluorescent dye is used for assessment of hepatic function or clearance or real-time intestinal angiography in the OR. Looks like.
What is
the-
indocyanine green?
That is correct. All right, the final question before we go to the final Jeopardy round, Bacta tank for 2000. This therapy recently approved by the FDA for use in patients with metastatic neuroendocrine cancer as a radiopharmaceutical agent that targets the somatostatin receptor. Looks like the Jawas.
What is PRRT?
Can,
Oh, sorry, the answer's up.
I don't know if we can give them that one. We should, yeah. We probably wanted it, what? All right. I thought they should have to name the actual, yeah, it's fine.
That's what it is.
We'll give it to them.
Yeah,
Thank you.
yeah.
It's close enough. There are other compounds that you can do PRT with that were not the one from that trial, but that's fine. All right. Okay, now for Final Jeopardy. So let me explain this. You're going to see the category first. So we got a game here. We got the Wookiees at 3,000, the Jawas at 10,800, and the droids at 13,000. You're going to see the category first, and then you're going to have to write down on a piece of paper in front of you your wager. You can wager up to how much you have, and then we will give you the answer, and then you write on the same piece of paper with your wager the question. Any questions about this process? So click on Final Jeopardy and we'll give you the category. We saw the scores. So here's the category. So before we move forward, oh, yeah, go back. Don't, okay. So wait for the music. So the category is use the force, Luke. The true category is energy in the OR. So if you will, write your wagers down now. Then raise your hand, someone, when you've written your wager down. Is there you have a wager? You have a wager? Middle finger. All right. Everybody's got their wager. So let's go ahead and show the answer. William T. Bovee, inventor of an innovative electrosurgical unit used by Harvey Cushing, went to college at this university whose colors remain present on the device's primary buttons. All right, before we show the answer, let's start with the Wookiees. Can you tell us what you answered?
We said, what is University of Michigan?
That is correct. What did you wager?
$29.99.
29.99. Add, you getting that back there, scorekeeper? 29.99 for the Wookiees. That's correct. It's the University of Michigan. Or as those of us who went there say, the greatest university in the world. Did you guys have it right? Did, and you wagered 10,700. They have it right as well, because that was too easy. And you wagered 22,000? 22.
Oh, no, yeah.
Yeah, you didn't have it. Yeah. So they wagered 22. Everybody got it right. Yes. Show the scores. Everybody, good job. You've been good sports. So the winners are the Jawas. Very exciting finale. Final Jeopardy. I guess that question was too easy. Well, that's it.
I believe we are done.
Yeah, we do want to get everybody for a photo. And we got the books. Are they in the back? We do have books for the winners, so stay tuned.